Hey there, and welcome. Today, we're taking a deep dive into a really common and pretty powerful medication, metronidazole. We are going to cover absolutely everything you need to know to use it safely and to make sure it works for you. So, if your doctor just handed you a prescription for this, it's totally normal to have some questions swirling in your head. What is this actually for? Is it safe for me? And am I taking it the right way? Don't worry, we're about to walk through all of that step by step. Here's a quick look at what we'll cover. We'll start with what metronidazole actually is, then we'll look at all the different forms it comes in, we'll go through a really important safety checklist, cover how to take it correctly, talk about side effects and warnings, and then wrap up with some frequently asked questions. Okay, let's kick things off with the most basic question. What exactly is this medicine that you've been prescribed? Well, what's so interesting about metronidazole is that it's kind of a two-for-one deal. It's an antibiotic, which means it's great at fighting off certain types of bacteria. But it's also an antiprotozoal, which means it can take on tiny little parasites too. It's this dual action power that makes it so versatile. And you can really see that versatility right here. It's used for such a wide range of issues, from skin problems like rosacea, all the way to mouth and dental infections. It can also treat things like bacterial vaginosis, pelvic inflammatory disease, and even infected insect bites or wounds. It's a real workhorse. But of course, it's only effective when a doctor has diagnosed the right problem. So we know what it does, but how will you actually be taking it? Let's take a look at the different forms it comes in. Now, here's something that's absolutely crucial to know. You can't just pick this up off a shelf. In the UK, and in most places, metronidazole is a prescription-only medicine. That means you have to see a doctor or another healthcare provider to get it, and for good reason. Your doctor will pick the right form based on what kind of infection you have and where it is. So you might get tablets or a liquid to swallow, a cream or gel to put on your skin, or a special gel for internal use. There are also suppositories, which can be an option. And then there are injections, but you'll pretty much only see those used in a hospital. Okay, let's pause here because this next part is incredibly important. Before you even start taking this medication, we need to go through a quick checklist to make sure metronidazole is actually safe for you. Think of this as your conversation guide with your doctor. You absolutely must let them know if any of these things apply to you. Have you had an allergic reaction to it before? Do you have any liver problems? Are you pregnant or breastfeeding? And here's a really, really critical one. Be honest if you feel you won't be able to stop drinking alcohol. Your safety is what matters most here. All right, let's get into the practical side of things. Taking your medicine the right way is what makes all the difference, so let's make sure we get it right. Okay, so if you have the tablets, it's a good idea to swallow them with a full glass of water, usually after a meal or a snack. That can help prevent an upset stomach. If you've got the liquid, always use the measuring spoon or syringe that came with it. Don't just guess with a kitchen spoon. But the two golden rules: 1, space your doses out evenly. And 2, and this is the big one, you have to finish the entire course, even if you start feeling a whole lot better. Now, for the creams and gels, it's pretty straightforward. Just apply a thin layer to the area that needs it, but be super careful to keep it away from your eyes. And, of course, wash your hands before and after you use it. There's also a very important specific instruction for anyone using the vaginal gel. You need to avoid having sex for the entire time you're using it. So, what happens if you forget a dose? Hey, it happens to all of us. The rule is simple. Take it as soon as you remember. The only exception is if it's already getting close to the time for your next dose. In that case, just skip the one you missed and get back on schedule. The key thing is to never ever take a double dose to try and catch up. Okay, let's shift gears and talk about the most important safety info you need to have. And we're going to start with the single biggest do not mix rule that comes with this medication. This is a hard and fast rule. There are no exceptions. You absolutely cannot drink alcohol while you are taking metronidazole. But here's the part that people often forget. You have to continue avoiding alcohol for a full 2 days. That's 48 hours after you take your last dose. If you mix them, you can have a really severe reaction. We're talking intense nausea and vomiting, stomach pain, a racing heart. It's just not worth finding out. This chart is a really helpful way to understand side effects. You've got your common ones, things like feeling a bit sick or having a weird metallic taste. You can usually keep taking the medicine, but it's a good idea to chat with your pharmacist. Then you get to the serious list. If you see anything like yellowing skin or you're getting unusual bruises, you need to stop taking it and call your doctor right away. And for anything in that emergency column, a severe rash, trouble breathing, that's a call to emergency services immediately. And, alcohol isn't the only thing to be aware of. Metronidazole can interact with other medicines, so it's so important that your doctor knows if you're on any of these drugs, like the blood thinner Warfarin or Lithium. And this includes everything, even herbal remedies, vitamins, or supplements you bought over the counter. Your doctor needs the full picture to keep you safe. All right, let's wrap this up by hitting on some of the most common questions that people have when they're about to start taking metronidazole. The big question is always, so when am I going to feel better? Well, for most common infections, you should start to notice an improvement within just a few days. But as you can see here, some things just take a bit more time. A stubborn dental infection might take a week or more to really calm down. And for skin conditions like rosacea, you might need to be patient for several weeks to see the full effect. And that brings us right back around to the number one rule. I know we've mentioned it, but it's so important it's worth saying one last time. Even if you feel amazing, like you're completely cured, you have got to finish the entire course of medicine your doctor prescribed. Stopping early is the perfect way to invite that infection to come right back, and sometimes it comes back even stronger. So, after all that, let's just take a second to think. What's the one key thing you're going to remember from all this? The one tip that's going to help you stay safe while you're taking your medication? Whether it's the no alcohol rule, or finishing the course, or just being open with your doctor. Holding on to that one key piece of info is the best thing you can do to make your treatment a success. Thanks for tuning in.